Welcome back. We're continuing our discussion with Trudo Lemmens as we unpack the MAID Death Review Committee report that was released earlier this year. Trudo, again, thank you so much for joining me today. So let's discuss the report. What were some of the more troubling findings that came about?
I would say there are three, in my view, troubling findings. The first one is that we see that in track 2 cases in Ontario, which are a minority of cases, it must be said. So out of 4,644 cases in Ontario, we had 116 people receiving MAID under track 2. And that in that category, track 2 cases, we have a much higher percentage of so-called marginalized persons. What does that mean? Well, these are people who, according to a well-accepted estimate based on postal codes, are more likely to have problems with housing. So marginalized because of housing, marginalized because of a lack of material resources. So in other words, more likely to be people living in poverty, and more likely people excluded from labor force or at an advanced age. So again, keep in mind, these are people who otherwise would have years or decades of life left. They are explicitly not people who are approaching their natural death, because otherwise they would fall into track 1. And they are disproportionately belonging to marginalized populations. That's one important finding. A second important finding, which is simply mentioned in the coroner's report, that's not developed in detail, but we see that there is a significant level of non-compliance. So keep in mind, again, MAID is introduced in Canadian law as an exemption to an existing criminal code prohibition. So it is an exemption to the criminal code prohibition of homicide and aiding and abetting suicide or providing a noxious substance. These are very important criminal code prohibitions that are aimed to protect people against premature death. And so if you see there violations of key criteria of the legislation, and you see so in other words, you see non-compliance, so people not following the rules that are built into the criminal code, I would say that's a serious problem. And that indicates that we actually have a lack of tight control over the practice. And a third element in the report is I would say, a very troubling cases that were reported. Again, these do not necessarily represent the majority of cases, or they do not represent the majority of cases. They were selected by the coroner's office to be discussed among the committee of which I'm a member, and where we kind of looked at what do these cases showcase. Well, they show that we do have in Ontario people receiving MAID who have a significant chronic illness, who are struggling with mental health issues, who are struggling with addiction problems in some cases. There is a case also of a man who is suggested by his psychiatrist that there is always the option of MAID, and a case also of a man who is actually transported or brought by his MAID provider to a place where he receives the procedure. So so I would say these cases highlight a type of drive of some providers to make sure that people have access to MAID. I would say they highlight a troubling focus on making sure that people have access to MAID rather than on protection against premature death.
Well, let's talk about that for a moment then. You yourself pointed out that, okay, track 2 in Ontario, that's 116 cases. Really, it's a small percentage of the 4,500 or so cases. Are these just like one-off anomalies? Like, why ought the public be concerned? Why should we care about these obviously very tragic but extreme cases?
Well, if we say that we have somebody dying, and I think here of the case of Ashley Smith, who died in an isolation cell in our prison system. If we have one tragic death in the province in troubling circumstances, normally what we would have is we would have an investigation. We have an investigation and look into what does that represent? Why are these cases happening? Here we have 116 people. That's not nothing. I mean, it's like a small airplane crashing. Why are these people, dying in circumstances that may be troubling? Keep in mind also that MAID Track 2 was introduced only in 2021. actually in March, April 2021. So this will expand. We will have more people receiving MAID under track 1. And further, I would want to emphasize that even track 1 cases may raise troubling issues that overlap with the concerns that we have about track 2.
Okay, I look forward to discussing that right when we return from this commercial break.